Systems trauma. It's this phrase that I think most frontline workers recognize pretty immediately when we talk about it in relationship to our clients. It's that harm that builds up after they're being bounced around and denied and delayed and discharged and referred and reassessed and told to call somewhere else, and trying to navigate systems that are supposed to help but often aren't. But I think there's another version of that I don't see described very often. What happens to the frontline workers who operate inside those same dysfunctional systems every day? That's what I want to talk about, and I think it's going to take some time. So I hope you'll follow along. This is a 7-part series exploring systems trauma and its impact on frontline workers. One of the stranger parts of frontline work is being responsible in part for a system that we don't fully trust ourselves. We know that the referral might get lost. The bed might not be there. The funding could fall through. The person we refer someone to might not get back to them. And yet our job is still to say, here's the plan with some degree of confidence, because we're looking for buy-in from the client. And if we showed them how much we actually trust the plan, that might not serve them very well. And over time, that maneuvering can change how we work. We start double checking everything, and we make backup plans for backup plans, and we call ahead because we don't trust the process to run on its own. And we become hypervigilant. Experience has taught us that things fall apart, so we brace for it before it does. And then that vigilance is earned. It's not necessarily something that we choose. Frontline workers like us are very good at finding ways around broken systems. And so as a result, I think the better we are at our job, the easier it is for broken systems to look like they actually are functional. Because we'll just call somebody we know. We will bend a rule, we will stay late, we will find funding elsewhere, we will drive the client ourselves. We will use our own phone, our own cars, sometimes our own money. And the system starts to depend on people like us doing things that it was never built to require in the first place. And here's the danger with that. Our resourcefulness can hide the failures of the system. Each of those workarounds is covering for something that the system was supposed to do and didn't. From the outside, the system looks like it's working. But it's working because we are quietly filling in those gaps. And after a while, we might start believing that when something falls apart, it means that maybe we didn't try hard enough. Frontline workers apologize for things we didn't do all the time. I'm sorry there isn't a bed. I'm sorry that nobody called you. I'm sorry that referral was lost. I'm sorry you have to tell your story yet again. And some of that is completely appropriate. We're acknowledging what someone went through. Something happens, though, when we spend years being the person who delivers the consequences of decisions that we didn't make. There's a risk that we start carrying institutional guilt as if it was ours. The system failed, and yet we feel like we failed. The system caused the harm, and yet we're the ones who go home replaying the conversation. For the person in front of us, we are the system. Whoever set the budget or wrote the rules about who qualifies never has to sit across from them. We do. And that's a particular kind of tired. It comes from saying sorry all day for decisions we didn't make and taking the frustration that comes back at us. You raise the same problem 3 times and nothing changes. So eventually you just stop raising it. Our clients in frontline care lose trust in the system. So it makes sense that the people who work in those systems, us, do too. Maybe you flagged the same issue for months and nothing moved, nothing changed. Maybe leadership promised support that never came. Maybe a serious incident happened and everyone was told there would be a review, but you never heard another word. Maybe staffing levels were unsafe for a long time and people were just expected to manage. After enough of that, workers just adapt. They stop reporting things, they stop asking, because they assume nothing is going to change. They build their own informal systems instead of using formal ones. And from the outside, that can look like someone who has stopped caring. And sometimes it is. More often, though, it's what happens after you've raised the same thing enough times to know that it won't change anything. And here's the cost. When you stop filing reports and flagging the problems, they stop reaching anyone who could potentially fix them. So the unsafe staffing or the issues you flagged for months stay exactly the way that it was, and the next person walks straight into it. Burnout is often the first word we reach for when someone is struggling. I think it can be helpful to be a bit more specific, though, because underneath what we call burnout, there might be exhaustion or moral distress or grief. And there might be systems trauma. Now, systems trauma is a bit different. It's what happens when repeated institutional failure starts changing the way that we think and work. And it's in everything that we've talked about so far in this series. The hypervigilance, the gaps that we quietly fill, the guilt that we carry for decisions that we didn't make, the way that we stop speaking up once we've decided that things won't change. Those aren't four separate problems. They're one response, showing up in four different places. Put them together, and that's systems trauma. A set of habits that we built to keep working inside a system that we couldn't count on. It's an injury. It comes from years of watching the system fail the people that we serve and fail us. The habits are real, the exhaustion is real, and none of it started with us. You can't care your way out of systems trauma. Here's what I think actually does help, though. We spend an enormous amount of time and energy trying to understand the people that we work with. We ask what happened to them. We think about trauma, about what they had to do to survive. We treat their behavior as adaptation. It developed somewhere, it served a purpose. And I think we can turn that same curiosity on ourselves. If you spent 10 years in a system where things routinely fall through, of course you're going to check everything twice. If you've watched people get hurt because you assumed someone else would follow through, of course delegating is going to feel unsafe. If you've been the one who always found the workaround, of course stepping back can sometimes feel irresponsible. If you've spent years delivering decisions that you didn't make and absorbing the anger that came back, of course you might start carrying some of that failure yourself. Seeing where these habits came from gives you a choice. You can look at each one and ask whether it still helps you here or whether you're carrying it out of habit. That question changes what you do next. Sometimes the answer is rest. Sometimes it's better boundaries or supervision or therapy. Sometimes it's changing how a team works. And sometimes the problem is structural and it needs a structural fix instead of asking individual workers to get better and better at enduring it. Frontline workers are shaped by the systems we work inside. Some of those adaptations make us very good at this work. They can also cost us something. Staying in this work for the long term might depend on being able to see both. So I'll leave you with a question. Maybe you check everything twice. Maybe you struggle to hand anything off. Maybe you say sorry for things that were never your fault. What is your adaptation? And do you still need it where you are now? This has been my series on systems trauma and how it affects frontline workers. Appreciate your comments, and thanks for following along.